Hey y'all, Eric Smith here with the monthly newsletter video. Just wanted to touch base on something that has come up in our office quite often the last couple of weeks. We've had some clients who've gone out to physicians' offices and tried to use their insurance card only for the doctor's office to say that they couldn't file the claim because Medicare still showed that their group insurance was active. So this is a situation where somebody has been working and they are retired and they've gone on to Medicare. They've done all the right stuff. They've completed the L564, they've done the 40B, they've applied for Medicare Part B, they've gotten their Medicare Advantage plan, but they go to the doctor's office and the physician's office is saying that they can't file the claim because it's showing that that Medicare is showing that they're still actively working, and their group insurance is primary, even though the group insurance has canceled. So what is happening in this situation is that there is a lag in communication between Social Security, the benefits administrator of the company that the person worked for, CMS. So there's just a communication lag. And so I wanted to explain something that some of you guys may know, some of you guys may not know, but there's a part of CMS called the Coordinations of Benefits and Recovery Center. So when you have a situation like this, instead of just calling 1-800 Medicare, the best thing for your member to do is actually call this Coordinations of Benefits and Recovery Center um, and tell them that you no longer, or the member is no longer working. So what I've done is I've created a guide that I thought would be, kind of helpful, just so you'll understand like coordination of benefits, and then kind of walking through like what's happening. And I'm going to post this on the website so you guys can have it. But I thought it would be nice to just kind of have some logic behind sort of what's happening and how to correct it. And then I've also created a guide that you can give to your clients. So one of the things that would be helpful, I think, is to have a little PDF that your clients could have that says, here's how to fix this. So here's what's happening, and then here's how to fix it. And just to kind of cut to the chase, just for this video, the best thing for your clients to do is, if this is happening to any of your clients, have them call the Benefits Coordination Recovery Center at the phone number that you see here. It is 1-855-798-2627, and basically just say, I'm retired. I'm no longer covered under my employer's health plan. I need to update my Medicare secondary payer. So the reason why this exists in the first place is, let's just say somebody goes on to apply for Medicare Part A at age 65, but they continue to work. And on that application, when they're online applying for Social Security, applying for Medicare, there's a question that says, do you have group insurance? And they say yes, and they put in their group insurance information. Well, that's going to sit there um, as their primary insurance because they're actively still working, right? So they put in their insurance. Medicare Part A is acting as a secondary insurance, and it just stays like that for many years until they get ready to retire. And when they submit their L564 to Social Security to say, hey, I'm no longer going to have Medicare Part, I want Medicare Part B. I'm no longer going to have this group insurance. What's supposed to happen is Social Security is supposed to inform Medicare that the group insurance is canceling. But here's where the lag is happening, that that information is not getting there um, for whatever reason. So when that happens, if a physician's office is saying, hey, it still shows that your group insurance is primary, they just need to call this number and let them know that, please take that group insurance off. I no longer work there. So just things to keep in mind. I thought that would be helpful for you guys. If there is something that, sometimes what's happening is people are emailing Robin, and Robin's probably coming back to say, hey, tell them to call the Benefits Coordination Recovery Center. I just thought it'd be nice to have it on our monthly newsletter so you guys could learn a little bit better about what's happening. And then I'll also attach these two PDFs as well, so you guys will have them. Hope you're doing well and look forward to talking to you guys soon.